Good day, my name is Justin. For this presentation, I'll be discussing the social determinants of health as defined by the Kaiser Family Foundation model and how they influence traumatic compound fractures of the lower extremity and the clinical outcomes that follow. I'm also going to be referencing 3 recent peer-reviewed studies from 2023 and 2024 that demonstrate how these determinants impact trauma care and orthopedic healing. The Kaiser Family Foundation identifies 6 major components to the social determinants of health. These include economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, social and community context, and the food environment. Together, these factors shape a person's overall health, their risk of injury, and their ability to recover from a traumatic event. When we focus specifically on compound fractures to the tib, fib, and femur, these determinants play an even more critical role. Open fractures require rapid surgical debridement, consistent wound care, strict weight-bearing precautions, and long-term physical therapy. Any limitations in finances, transportation, insurance coverage, health literacy, or social support can delay treatment or interfere with the recovery. These delays directly increase the risk of infection, non-union, and long-term impairments to mobility. Recent evidence highlights the relationship clearly. Turley and colleagues in a 2023 trauma-focused study found that low socioeconomic status, unstable housing, and transportation barriers were strongly associated with delayed medical care, longer hospital stays, and worse outcomes after traumatic injuries. For open fractures, these delays can lead to higher infection rates, a greater need to repeat surgeries, and in some cases even amputation. In 2024, a study by Trong and colleagues examined social determinants and fracture outcomes. Although the study focused on distal radius fractures, the findings translate directly to lower extremity trauma. Lower income, lower education level, and limited insurance coverage were linked to slower healing, more complications, and reduced functional recovery. These same determinants would affect a patient's ability to attend follow-up visits, adhere to wound care instructions, or consistently participate in physical therapy, all of which were essential for preventing hardware failure, infection, and long-term gait abnormalities. Another 2024 review by Troyer highlighted how insurance status, environmental hazards, and access to rehabilitation services affected orthopedic outcomes more broadly. Patients with limited insurance often experience delayed surgical management, which is especially dangerous in an open fracture where treatment needs to occur quickly to avoid infections. Environmental barriers such as unsafe neighborhoods or lack of access to transportation also interfere with a patient's ability to attend rehab, to obtain assistive devices, and safely perform mobility exercises at home. Across these studies, the message was consistent. The social determinants of health have a measurable impact on clinical course of traumatic orthopedic injuries. Economic stability affects access to surgery and rehab. Education influences a patient's ability to follow weight-bearing restrictions and wound care instructions. Healthcare access determines whether patients can receive timely surgical interventions and consistent follow-up. Neighborhood conditions affect the safety of their recovery environment and their ability to walk or exercise. Social support influences adherence and motivation. Even food security matters because poor nutrition status can impair bone healing. By understanding these determinants, clinicians can better anticipate barriers that may interfere with recovery after a compound lower extremity fracture. This allows us to provide more individualized care, improve communication, and link patients to resources that support healing. Recognizing the role of social determinants of health ultimately leads to better functional outcomes, reduced complications, and a more patient-centered approach to orthopedic trauma care. Thank you.